For 10 years, I've had the privilege of working as a pediatric nurse in Houston, Texas. In 2018, I accepted a job at Texas Children's Hospital, the most prestigious and largest children's hospital in the United States, not knowing that a fully functional and robust gender clinic was active in my workplace. Eventually, I was asked to do things that went against my nursing ethics, my personal beliefs, and most importantly, my faith in Christ. One day, a physician asked me to do patient teaching, which is not uncommon, but on this particular day, I walked into a patient's room, and I was asked by the doctor to instruct them on how to administer an intramuscular injection. What I didn't know was that this child was going to administer estrogen to himself to affirm the false identity that he had adopted. And realizing that I enabled him to do that was devastating to me. I considered quitting my job. I could no longer play an indirect role in perpetuating these harms against children until May of 2023, when I read an article by an anonymous whistleblower within Texas Children's Hospital who had come forward courageously to expose that the hospital had been secretly providing transgender treatments to children, had hidden this from parents and from lawmakers in the state of Texas. And I knew this to be true because I was one of the nurses working at this clinic that was supposedly non-existent. This person is Dr. Eitan Heim, without whom I would not be here today. We did not know each other at the time, but what I did know was that someone within the hospital had shared my concerns. And so a couple of days later, I came forward anonymously to corroborate his testimony. 2 months later, my husband and I were having dinner on a Monday night, and there was a knock on the front door. We go to open the door, and there are two federal agents who are flashing their badges. They say they're from the FBI, and they're asking specifically to speak with me regarding issues at my work. These agents informed me that I was a person of interest in an investigation targeting not a whistleblower, but a leaker who had allegedly violated patient confidentiality laws by breaking HIPAA, which was, of course, a complete lie. They were trying to turn me and to use me to speak against Dr. Heim. They informed me that if I didn't help them, my career and my safety were at risk, and it was the most terrifying encounter we've ever had. I went back to work, and I discovered not only had the hospital lied to the public, but they were also billing Medicaid fraudulently for these cross-sex hormones and puberty blockers, which in Texas is a violation of state law. I saw children that were misdiagnosed intentionally. I saw false diagnoses. I saw all these things that were deeply concerning and 100% illegal. And I knew that I had to come forward to expose that the hospital was committing fraud. In June of last year, I came forward publicly with my identity, and in August of last year, the hospital fired me. This was illegal for a number of reasons. 3 months later, the Trump administration announced a formal investigation into Texas Children's Hospital for illegally terminating my employment. I'm very, very grateful for that. I now have the privilege of serving as the founder of Protecting Texas Children. We work towards building a future where children can grow up happy, healthy, and whole.